WFSB 3. This is CT24 with Eric Parker.
Good morning. On Monday, in an opinion piece in the New York Times, U.S. Surgeon General Vivek Murthy called for warning labels on social media platforms, writing those platforms can be harmful to the mental health of children, especially adolescents.
It's unusual to apply a Surgeon General's warning label, but we find ourselves in a unique and unusual situation. This youth mental health crisis that we are living through, with extraordinarily high rates of anxiety, depression, and suicide among young people, this has become the defining public health challenge of our time.
Joining us this morning to discuss those recommendations are two doctors from the Yale Child Study Center. Dr. Linda Mays is the director, and Dr. Jan Pontzen is a child psychiatrist there. Thank you both for joining us. Dr. Mays, I want to start with you. You just heard some bold language from the U.S. Surgeon General, calling it a youth mental health crisis, the challenge of our time. Do you agree?
I absolutely do agree. And I'm very grateful to the Surgeon General for calling attention to something that I and my colleagues, including Dr. Pontzen, have been calling attention to for a while. America's children are hurting, and they're hurting for many, many reasons, but we certainly have been seeing an upsurge in many mental health needs among children, younger, more severe, lasting longer. The Surgeon General has done a great service.
Do you have an easy way to draw that line between what you're seeing and social media? Is it just because that's what the folks that you're talking to are telling you, Dr. Mays, or is it obvious to you, or is it just one factor?
It's just one factor, and I don't want to in any way diminish the impact of the Surgeon General's call, but it is just one factor. And certainly those who are doing very, very careful research on the impact of social media on children's mental health will say that there are many other things besides social media. What has to be said, though, is why the Surgeon General's call is so important, is that it empowers parents who have been very worried about why their children, what's the impact of their children's considerable time on social media? How do they help their children with social media? It empowers parents to be able to be more effective in addressing this. Sure, we need more data. Sure, we do. And it is a multi-factor problem, but it is certainly contributing.
Dr. Pontzen, I want to turn to you. If someone came to you and said, I think my child has been adversely affected by social media, what are the types of things you're expecting to see there? How will it affect the child? What are some of the telltale signs that you might see?
I think there are a couple of telltale signs that you'll see in a situation like that. One is the effect of the excessive use of the device. So one would be up late at night, having trouble falling asleep, and difficulty focusing and concentrating in the school day. For someone that might not have more serious effects of using social media. And then we have other kids that we see that have significant depression and anxiety, whether it's reinforced by social media as a contribution, social media as a cause. There's a significant role of social media in how a child might be presenting.
I don't want to use a term of art from your world incorrectly, but a lot of what you just described, Dr. Pontzen, sounds like addiction to me. Does it sound that way to you?
I think it does. I think there's still some debate about how to describe this. I think a lot of folks use the word behavioral addiction as a distinct from addiction as thought of dependence through alcohol or others, but there certainly are elements of behavioral addiction to use of social media.
Dr. Mays, I want to turn back to you. You talked about having that ability to have parents say, well, see, there's this warning on there. And I was doing some research in preparation for talking to the two of you, and I saw just this past week the LA school district banned cell phones altogether. And then I saw someone else saying that, in opposite of that, this was going to be like those explicit lyric labels on audio CDs back in the 90s, and everyone was going to ignore it. Do you think that this will be something that people will take seriously?
I wish I had a better crystal ball. But what I would say is I hope they take it seriously. And I hope that we take it seriously, not in the blanket banning, not in the all is bad kind of way, but to have serious conversations and about what are the strengths of social media. Social media has changed our world. What are the strengths? How can we more effectively help our children and ourselves use social media? In many ways, it's similar to the earlier conversations about, is television bad for children? It's not a blanket statement. Used responsibly, used with adults, used with help and guidance, social media can have very positive impact.
Is convincing the parents one piece of the puzzle, though? Because we had someone from the Connecticut Teachers Union on towards the end of last school year, and she said when they ban cell phones in schools, the complaints don't come from the kids, they come from the parents. So is there a concern that this might be part of it, is educating the parents ahead of educating the kids, Dr. Mays?
Yes, of course, educating all of us, quite frankly, not just, I don't want to call out just parents. It's educating all of us to think about where are the responsible uses and where are the times where it can't be safe. So when you as a child or as an adolescent using social media and all you get are information about what, for example, is the perfect body image or what is the perfect way to behave, that's a use of social media that's not effective. When it allows you to open up your world and be able to be in communication with people around the world, that's a positive side. So educating all of us of what's the positive and what are the risks.
Well, let's jump off of that. Dr. Ponson, I'll turn to you. What's the advice for parents? And let's start that education process right now. If someone comes to you and says, I have an 8-year-old, a 10-year-old, a 15-year-old, whatever the age would be, what are some things I should keep in mind? What do you tell them?
There's a couple things that we do. And first of all, a lot of this is about small steps that are taking in different areas to empower parents to make easier decisions, less guilt-ridden decisions, and have their children accept their rules more easily, so because they're not in competition with other kids also having devices. So whether it's not in school, putting a warning label, raising the age for social media with some teeth, all of those are elements to really help empower parent. Because right now parents have to act alone in making these decisions, or it feels alone at least. I think the biggest part about a young child, 8, as you described, is what are they going to be exposed to in social media? So free roaming internet phone is simply inappropriate at that age to own and to have, and it's not recommended at all. On the other side of things, and I would not recommend a free roaming internet social media access phone essentially until 16, and then work your way backwards. That is a really hard age for a lot of parents or teenagers to accept, but this is what I'm talking about when we start to implement better expectations, social cultural expectations around phone use, much like we did for cigarette smoking. There'll be a greater acceptance that doesn't seem an unachievable age. So between 8 and 16, could be a great wide variety about what is done, the degree of monitoring or non-monitoring. I'm not a fan of monitoring kids' activities as the default approach. Sometimes some kids need that. So the approach can be highly individualized.
Well, I think that's some good advice for parents. Certainly a lot more to be said about this topic, and I know you both will be studying it going forward, the Surgeon General putting a spotlight on it. I appreciate you both being here. I'm sure a lot of parents of young children and teenagers were watching very closely this morning. Dr. Jan Ponson, Dr. Linda Mays from the Yale Child Study Center, thank you both for being with us here on CT24.
Thank you for the opportunity.
Thank you.